Hello humans, welcome to the first episode of In Bed with hEDS. As you can see, I'm in my bed, and less obviously I have hEDS, hEDS, hypermobile Ehlers-Danlos Syndrome. In this limited series, every time I have to call off from my day job due to symptoms of this disability, I will create a video talking about what I, and by extension, what others have to deal with when they have this hereditary genetic disorder. Is that a redundancy? Hereditary genetic. If a condition is hereditary, then it is genetic. But you can have a genetic disorder that is not hereditary. Mutations and environmental factors can cause things to go wrong with your genes, so it's not redundant because it defines what kind of genetic disorder I have. So there you go. There will be plenty of asides like that. In this first episode, I'm going to explain just one thing. What my disorder, hypermobile Ehlers-Danlos Syndrome, is and how it works. There's a lot of information out there, so I'm not going to go into a lot of detail, like all the scientific jargon. Future episodes will take one topic that I mention here and elaborate on it, and hopefully in an entertaining and informative way. Okay, so now we know what we're doing here. Let's get started. The reason it is spelled like this, little h, big EDS, is that the H denotes what type of EDS I have. You often see them called the Ehlers-Danlos Syndromes because EDS is actually a family of 13 genetic disorders, all of which affect the production or use of collagen in the body in different ways. We have orthochalasia EDS, brittle cornea syndrome, classical EDS, classical light EDS, cardiac valvular EDS, dermatosparaxis EDS, hypermobile EDS, kyphoscoliotic EDS, musculocontractual EDS, myopathic EDS, periodontal EDS, spondodysplastic EDS, and vascular EDS. A couple of those are hard to say. As I said, I have hypermobile or hEDS, the technical definition of which says that it is a progressive degenerative genetic disorder affecting body's connective tissue. When I first looked it up, I thought that means absolutely nothing. Makes no sense. I mean, where's the context? I had to break it down and see just what all those words mean and how I can put them into the context of me. So let's do that. Progressive. That means the longer you have it, the worse it gets. My first reaction when I read that is that actually doesn't make any sense for a genetic disorder, especially a hereditary one. I was born with the gene that is causing me all sorts of issues. It is not getting worse in terms of the gene variant itself. It's not changing. The bad gene I was born with is the same gene I've had my whole life and the one I have today. And it's all the same thing. How can we be progressive? However, my symptoms are getting worse. I've had symptoms my whole life, but they were never that big of a deal. I was fine most of my life. I have a mild presentation. I had a few surgeries for weird problems. I had weird joint injuries that laid me up for a while, but nothing felt debilitating or disabling. That changed a little over 10 years ago when I dislocated my sacrum for the first time. But it's only been the last 2 or 3 years that everything has gotten really bad. I asked my doctors why it got so bad recently, and the answer was basically, we don't know. It just does that sometimes. When the symptoms keep multiplying and getting worse very quickly, that's called snowballing, at least in the online communities I've seen. And so my symptoms have been snowballing for the last 10 years, just getting bigger and bigger, worse and worse. So the gene is not progressive, but the symptoms can be. As for degenerative, that describes what my body is doing, degenerating. I'm literally falling apart. It seems that every day I discover a new pain or a different part of my body starts to act weird. There's no other way to describe it. My body just does weird things. Joint or back injuries for no apparent reason. Yesterday I was just walking along and my hips went funny. I have internal organs go haywire, muscle contractures, extreme fatigue. There'll be episodes on all of this. Okay, moving on. Genetic disorder is how I got it. I was born with it, inheriting it from one of my parents who probably didn't even know they had it. For other types of Ehlers-Danlos, there's a genetic test to show exactly what kind of disorder you have. Hypermobile type? Not so much. The diagnosis is made by testing your joints. If they move more than they're supposed to, you're hypermobile. That they make the diagnosis if you are hypermobile and fit some other criteria, such as having a family history of the disorder. In my case, it's my kid. I have passed it on to them. It was actually their symptoms that got me looking at my medical history, which led to me getting my diagnosis. Went to a doctor and said, look at all this. They're like, oh yeah, you have EDS. I think I got it from my mom, but she was never diagnosed, so not sure about that. Now for the crux of the issue, affecting connective tissue. Connective tissue makes up about 80% of the body. This is what makes EDS so annoying, painful, debilitating, whatever. Skin, eyes, gums, lungs, blood vessels, internal organs, tendons, and ligaments are all made of connective tissue. So EDS can damage all of them. Thankfully, no one type of EDS affects every type of connective tissue. What causes the various EDS types I mentioned is what gene is mutated and how it tells the body to make or utilize collagen, which is the building block of connective tissue. There are 19 types of collagen in the human body, and the type of EDS you have depends on what kind of collagen you have a problem with. People with hypermobile EDS have weak collagen in the skin, parts of the GI tract, lungs, tissue surrounding the muscles, and critically, the tendons and ligaments, the structures that hold your joints together. This weakness of the joints is what gives the disorder its name. The tendons and ligaments are too soft or stretchy to keep your joints together properly, so they move too much, which is called being hypermobile. Thus the name. Some people will ask, what's the big deal? Well, this is the big deal. My jaw is the easiest joint for me to dislocate and reset because it's been popping out of place since I was a teenager. But I'm at risk of that happening to all my joints. All my joints. Shoulders, hips, knees, elbows, wrists, ankles, every vertebrae in my spine, especially my neck, and even this joint. The distal interphalangeal joint of the fifth finger. That means I pop my pinkies. When your joints, that's ridiculous. When your joints are that loose, you get pinched nerves and blood vessels, you get osteoarthritis. Because that collagen is in the GI tract, you can get GERD, IBS, frequent constipation. Because it's in your nerve sheets, you can get neuropathy, which is when nerves die. Then there's dysautonomia, which affects your autonomic nervous system. It makes it go haywire. Lots of ways that happens. Then there are morphological issues like flat feet or high-arched feet, a high-arched palate, and crooked teeth. Then there are all the other disorders that seem to go hand in hand with hEDS, like ADHD and mast cell activation syndrome. ADHD I have, MCAS not so much. The list of issues goes on and on, much like this video, so let's move on. I had surgery in early April of 2020 to fix some poor healing caused by hEDS. My skin doesn't heal normally because of the disorder, so sometimes scars get out of control and spread or build up. I have nerve issues, gastric issues, and of course joint issues like arthralgia in my hands, and my shoulder is so unstable that my arm will just fall out of joint occasionally. My kid is also going through this same thing, but worse. They're only 18 and already using a wheelchair. The presentation of these genes is, or maybe just this gene, is much stronger than mine. So there's a quick primer on what hEDS has. In future episodes, I will go more in depth about what Ehlers-Danlos is, what it's doing to my body, and what the treatments I'm having are. Essentially, it's a one-person docuseries on the struggles hEDS can cause as I am sitting here in bed. Thanks for watching. See you next time. In the meantime, I hope you'll consider this. Thanks for watching my channel. Please click like, share, and subscribe, and check out my other titles. Have a question for any show? Send it to questions@addisonsagenda.com. On my website, addisonsagenda.com, you can learn about booking me to speak at your event and much more. All money made from speaking, videos, or through a GoFundMe goes to help with the medical bills my kid and I have due to hypermobile Ehlers-Danlos Syndrome. The link to the GoFundMe is below, as is a link to the Ehlers-Danlos Society, where you can learn more about EDS. Thanks again for watching. Peace and long life.